You dislocated your shoulder playing sport and you're a young athlete. What do we do next? And the decision is very involved, as orthopedists have been doing research on these types of injuries for a long time to understand what happens if you do surgery to stabilize that shoulder joint versus just letting it heal the best you can and trying to move on with your life and get back to sport. And the answer is very important so that you can make that decision. The first step is to understand what that is and what type of injury this is. And there are different types of dislocations of your shoulder. If this is your ball and socket, you've got an anterior dislocation where the ball goes out the front of the joint, and you can also dislocate it going to the back of your joint, which is far less common. The anterior dislocation typically happens when your arm is outstretched. You might fall on the ground or have a hyperextension external rotation injury, and the ball can pop out. You'll feel pain, you'll feel instability, and sometimes it'll pop right back into place. Other times it stays out of place. You have to go to the emergency room and have it put back in place. Once the shoulder is back in place, that's where the decision making has to start to play a role. Usually patients will come to my office and come to modern orthopedics to be evaluated and start to understand what the options are. Now, the options tend to be one of two things, generally. If you have an anterior dislocation, which is by far the most common type of injury, it's to stabilize the soft tissues that have been torn to help the shoulder maintain its stability going forward, or let the soft tissues heal themselves where they are and slowly rehab that with therapy, and then try to get back to activities, sports, and other things in life. Understanding the risks and benefits of both of those paths is crucial to making the right decision for you. You just dislocated your shoulder. Do you need surgery? Let's break it down. So a shoulder dislocation is when the ball and socket pop out of the socket from usually a violent kind of injury, falling onto an outstretched hand, rotation of the shoulder, and maybe someone falls onto your shoulder as you're falling down. You know, as you might expect in like a sport like football, basketball, and other things where your arms are outstretched. If that ball pops out, you know for sure you have definitely torn support structures. And once the ball is back in place, those support structures, even though they're back sort of in the neighborhood, they're still torn. And so that's the decision we have to then make is, do we repair them back or try to let them heal together the best we can with just some therapy and slowly getting you back to sport? So common causes of anterior dislocations of the shoulder are things like falling on an outstretched arm with it rotated when you're playing sports like football, basketball, volleyball, sliding into a base in baseball, really anything that traumatizes the shoulder with it in an extended, outstretched, vulnerable position. Okay, so you dislocated your shoulder and you want to proceed with surgery. What do we have to do? Usually we have a Bankart lesion, which is what we call a labral tear at the anterior inferior portion of the glenoid. You got to think of the glenoid as basically like a golf tee, and the head of the humerus is like the golf ball. So it's fairly kind of unstable, and we have this sort of supportive structure, and the labrum is this sort of rubber bumper running around the rim of the golf tee. Now, the rim of the golf tee is torn off, and so we need to then reattach that rubber bumper. And so in order to do that, we can use little anchors attached to the rim of the tee and suture those back, which give nice, stable, supportive tension on that torn structure that then allows the hammock, so to speak, to hold the ball in place. And that will be really, really helpful for recovery and for later support while the tissue heals back to the rim of that tee. Sometimes there's also more complex tears that require more repair around the other side of the tee, or even sometimes the rotator cuff in more complex high energy injuries. Hey everyone, thanks for watching. We take a lot of time and care to make these videos to hopefully help you guys out. If you would be so kind to like and subscribe, it would mean the world to us. Now back to the video. So after shoulder surgery, recovery takes time, as with any kind of repair type procedure. First and foremost, we want to rest the tissues for the first week or two. Then, usually within the first week or two, we will start a process of physical therapy that is just guarded, but also allows some early motion. We don't want to overstress the repair, but we do want to get you moving. There's a lot of motion that we have to recover with the shoulder. Slowly, we externally rotate over the course of several months so that we gradually increase the amount of external rotation, which is sort of tensioning where the repair goes. And usually in terms of return to sport, which is a lot of my patients who are having their shoulders stabilized after dislocating them, are looking to go back to things like football, soccer, baseball, basketball, or even martial arts. I don't want my patients usually getting back to contact, full, unrestrained activity until about that 7 to 9 month mark. And everyone's a little bit different in terms of how they're behaving and how they're feeling. But we want to make sure, even though you feel great, that the tissues are strong enough to withstand another injury so that you don't have a recurrent dislocation. So when I first evaluate you in the office, I'm gonna look at your shoulder x-ray to make sure the bones are all intact. Sometimes you'll actually even break off a rim of the glenoid, and that can be something to really be mindful of, because that could really change our decision making in terms of really being much more certain that you might need surgery if it's a big piece of bone. That being said, even then, if we get an MRI, which I always do after a traumatic injury to a shoulder or a dislocation, I wanna look at how complete a tear there may be of the labrum. Sometimes there's a smaller portion, what we call a Bankart lesion. Sometimes it goes all the way around the clock face of that glenoid, which is basically like, it looks almost like a clock face, and we think of it that way, where this glenoid labrum is basically a rubber bumper going around the entire face, and all the supportive structures are attached to that rim. You can have a tear on one side and it can be unstable, and that can still require surgery, but sometimes that tear can go all the way around the back and all the way up to the top, something we would call potentially a 360-degree tear. That's a really severe injury and something that we would really strongly consider surgery on a younger adult especially. So, if you're a young adult and you just dislocated your shoulder for the first time, I'm talking you're in your teens, your 20s, you're playing a sport, playing basketball, you dislocate your shoulder. Should you have surgery or should you just do therapy? And the answer when it comes to redislocating your shoulder in the future is pretty stark. If we do surgery on your shoulder, you have around a 8 to 10% chance of potentially redislocating your shoulder again. Versus if you don't have your shoulder stabilized, different studies have different numbers, but it could be anywhere from 60 to 80% redislocation rate. So that's a big difference. And so that's one of the things that really strongly encourages us to educate you about the benefits of surgery after a dislocation if you're a young adult and you just dislocated your shoulder. So when we think about outcomes from surgery, we also want to think not only short-term but long-term. When we look at long-term outcomes for shoulder stabilization surgery versus no surgery at all and just rehabbing your shoulder, there actually was a recent meta-analysis in the Journal of Shoulder and Elbow Surgery in 2022 that looked at that. And one of the long-term differences between patients who had shoulder stabilization versus those who just rehabbed their shoulder, the ones who had the surgery in the beginning were far less likely to have a subsequent surgery. So those, again, who didn't have surgery in the beginning were far more likely to have a surgery later. Additionally, those who had the surgery in the beginning after their first dislocation versus not having a surgery in the beginning, when we're talking long-term outcomes, 5 to 12 years after the initial dislocation, those patients were actually found to have a higher WOSI score, which is an outcome measure that basically is asking about your shoulder function in light of instability type of symptoms. So it seemed like the patients who were treated surgically and stabilized early after a first dislocation did a lot better in terms of their shoulder function and having less symptomatic instability later down the road, a decade later. If you've experienced a shoulder dislocation and you're wondering if surgery is the right move for you, you're not alone. The decision is a very personal one, and it requires us to go through your goals, your activity level, and other features about your particular injury. If you're an athlete, an active individual, or you've dislocated your shoulder multiple times, early surgical intervention will give you more stability, a stronger shoulder, and frankly, just peace of mind for years to come. At Modern Orthopedics of New Jersey, we take the time to walk you through the details of your case, assess your options, and help you make the best decision for you.